What makes post-acute medical health specialty hospital of Rocky Mount great is its people. We specialize in taking care of medically complex patients. We see patients who have had surgeries and perhaps need complex wound management. We see patients who may need an additional 4 to 6 weeks of antibiotics. We see patients who are on the ventilator with the goal of trying to get their trachs out and get them to their next level of care.
Eric was in a major car accident. He almost didn't survive. And the hospital where Eric was located, they were going to discharge Eric. Eric was sick and he was not ready for therapy at that point. He was still a patient in need of medical care from a hospital facility. We had to remove the trach to go to the next level, no matter what we did. And they were very confident they could do it. Finding PAM when we did was worked out extremely well.
Most of our patients, by the time they get to us, they've been hospitalized for weeks or even months. So when we get a ventilator patient, the first thing we want to do is start getting them mobilized. Again, PT and OT, we start with strengthening. Rehab works with the nursing staff to start ensuring these folks get out of bed every day, and that helps improve their lung function. We have physical therapy, occupational therapy, and speech therapy. And the speech therapist is able to do a swallowing study at bedside, and she's able to start them on a diet where they can start eating some good Southern food again.
We've started a new complex wound care program here at Post-Acute Medical. It's wounds that are chronic. And what we've been trying to do is get the wounds into shape, get them cleaned up, and then go ahead and sew them. This is a novel technique. We have a very good wound care team. Any new treatments we want to implement are easy because the folks have been here for so long.
When I woke up at PAM Specialty Hospital, I realized I was on the ventilator and thinking, I can't move anything from the neck down, so what's it going to take to get me back to normal? Dr. Shiver came in to speak with me. She said, if you'll listen, I will get you off the ventilator. So when I arrived back home, and when I saw my wife and my daughter, it just made it all so worth it to see their faces and to see their faces with smiles.
Our ventilator weaning rate here is about 80 to 85%. And we have the confidence because one, we have one of the best pulmonologists, intensivists here, very aggressive with weaning. And we have the patient results to show that we're able to make a difference and to successfully get patients off ventilator. When a patient goes home, it makes one feel just a tremendous sense of joy. We have to always remember that we work for the patient and we take tremendous pride in what we do.